Everybody, this is the 1419 for Datathon. We are the BEAT team, short for Better Intubation Timing in Sepsis. I am Yang Xiao, and our mentor is Tom. Here are our team members and logo. We have 4 doctors and 5 data scientists from different institutes. And the title of our project is Timing of Intubation in Patients with Sepsis. Better look at respiratory parameters. I will present it from these aspects. Sepsis is a process of imbalance of oxygen supply and consumption, which leads to cell hypoxia and organ dysfunction and even death. Intubation and ventilation improve hypoxia in septic patients. However, clinicians intubate septic patients with hypoxemia. But hypoxic patients might not present hypoxemia, but have other abnormal presentations. Inappropriate timing of intubation may relate to worse prognosis. We need to figure out the earliest and most sensitive parameters to predict intubation. Here, we aim to find the better timing of intubation in sepsis patients for better clinical outcome. In our study, the definition of sepsis are according to the Sepsis 3. These are our inclusion and exclusion criteria, and therefore our flow chart. We extract the data as presented. Missing data variables below 30% were selected for our study. We divided it to 2 tasks. Task 1, intubation-related factors and probability assessing. Task 2, mortality risk factors and probability assessing. Here are our results. First, this is our baseline characteristics. In non-intubation group and intubation group, they have no difference. In Model 1, we first look at the decision factors for intubation in the mimic dataset using random forest model. The figure shows respiratory index, respiratory rate, and PaO2 at the top 3. Not surprisingly, most of them are respiratory indicators. Model 2, prognosis after intubation. We look at the risk factors associated with in-hospital mortality among the intubated patients. BUN, SBP, and platelets come as the top 3 indicators. Model 3, intubated based on expert practice. Learned from the MIMIC 3 data, our model can tell what is the right time to intubate. We show in the figure that when the time comes to the true time of intubation, our score increases in the intubated patients. And this is the real-time mortality monitoring. Model 4, prognosis in real time. Clinicians will also be able to get a better guess of the prognosis after intubation. The figure shows that the patient died in hospital have a higher score throughout the course, and the score sharply increase near the time of intubation. And here is another real-time mortality monitoring of sepsis patients with intubation. Our study has some limitation, and we have our perspectives. First, this is a single center, have a small sample patients, and also a retrospective study. We aim to verify in other database or centers, or design RCTs to verify it. As conclusions, we developed a decision-making support system for better timing of intubation in septic patients for better clinical outcome